Welcome. This is Eric McCoy, aka McCoy, aka EMAC, from the University of California, Irvine Department of Emergency Medicine. And in this tutorial, I'm going to provide a brief overview of the materials in your simulation scenario author packet. Objective. I am going to provide you a brief overview of the materials in your simulation scenario instructor packet. And so there are almost a dozen items in your simulation scenario author packet, and in this tutorial I'm going to provide a brief overview of all those items that are going to be used by you to assist you in creating your simulation scenario. The first item in your simulation scenario author packet is the instructions file. And in this instructions file, you're basically going to find a file that can serve as a template or a table of contents that's going to give you insight into all the materials you have available for you in the package to help you create your simulation scenario. Now, in this instructions file, you're going to have a brief comment on what each of the other files or folders are and how you can use them to create your simulation scenario. The second, third, and fourth item in your simulation scenario author packet primarily pertain to the bulk of what you're going to be using to create your simulation scenario. The second item is the scenario book template. So this is the template you're going to be using to create your simulation scenario. And in this template, you're going to find instructions to fill out each individual specific section. And so as you're filling out your template, you're going to be basically erasing the instructions from the template because they are embedded within the template. There are also instructions that refer you to other resources in your package if in fact you need them. For instance, when you get to the objectives section on the simulation book scenario template, you're going to be referred to a different resource on how to create those educational objectives. The third item in your author packet is a scenario example. And so in this simulation scenario example, you're going to see what a completed simulation scenario template looks like to use as a reference point when creating your simulation scenario. The fourth item in your author instruction packet is the simulation stimuli resource folder. And in this folder, you're going to find the resources that you need to create both your laboratory stimuli as well as your visual stimuli. Now, for the laboratory stimuli, there are going to be several different templates that you're going to use to just simply input the data for your simulation scenario. For instance, if your case requires a CBC, a complete blood count, all you're going to have to do is input the data for the CBC values. Then you're going to convert those templates into image files, and the instructions on how to do that conversion is provided for you in your package. Now, with regards to the visual stimuli, these include things such as EKGs, chest x-rays, CT scans, even video files such as fast scans on somebody suffering trauma and you need to look in the right upper quadrant to see if there's any free fluid. So audio files, video files are the visual or the other extraneous files that go along with your stimuli that require your laboratory input. The fifth, sixth, and seventh items in your simulation scenario author packet basically are resources that are going to help you fill out your simulation scenario template. The fifth item is Bloom's Taxonomy of action verbs. Now, when you get to the portion of your simulation scenario template where you're going to have to create the educational curricular objectives, this Bloom's Taxonomy, these few files in this folder, are going to provide resources for you to help you creating your educational objectives. In general, when we think about creating educational objectives, we think about the conditions for which our learners are going to experience. In this instance, it happens to be a simulation. Then we think about the audience. Who is our audience? There are sections of your simulation scenario template where you're going to click off the buttons that specify the audience that your simulation scenario is targeted towards. Then we have to ask ourselves, what behavior are we trying to have an impact or an influence on? Essentially asking the question, after experiencing this simulation-based educational session, what is your learner going to be able to do or understand as a result of this experience? And so the resources for you with regards to creating your educational objectives are here in Bloom's Taxonomy of action verbs. The sixth item in your package is a reference guide, and this is basically a guide for the references that you may want to access or references you may want to consider when doing the background research and creating your simulation scenario. Further instructions are in this guide, but in general, you want to access the highest quality evidence available at the time you create your simulation scenario. For instance, if your simulation topic is ventricular tachycardia, you may want to access the national guidelines, the American Heart Association guidelines on advanced cardiac life support on that specific topic. The seventh item in your scenario package, or in your author package, is the AMA citation style file, American Medical Association. Now, again, this is going to be in a book type of format, and in the medical literature uses AMA type of citation style, so we are also going to use the AMA citation style. And to remind us on how do we reference our references the appropriate way, there's a file in your simulation scenario author packet to assist you in documenting your references appropriately. The eighth item in your simulation scenario author packet is the STR, or Simulation Topic Review file. Now, basically and essentially, the Simulation Topic Review is a consolidation of the knowledge you gained when doing your background research to learn about your specific simulation topic, to learn about your specific medical condition that you're using as the nidus for all the educational materials that you're creating. Now, essentially, this is going to be a 1 to 2 page document that is going to be in a bullet point type of format, and it's going to be roughly the same equivalent of a pearls or a Cliff's Notes of what you want the instructor to become refreshed on, or you want the learner to learn. For instance, this simulation topic review file will have, well, what is the definition of this medical condition for this simulation topic? What is the clinical presentation? How do you evaluate and work up this type of clinical presentation? And last but not least, how do you appropriately manage this medical condition? And this simulation topic review will serve many purposes. 1, it'll allow you to consolidate that knowledge that you gained. 2, this could be used as an educational resource for the instructor who will be providing the education to the learners using your simulation scenario. 3, this resource can be used to create additional resources, such as creating handouts for your learners during the debriefing, or creating different worksheets. But at the end of the day, if the simulation instructor simply wants to just have a refresher or to review the simulation topic, this is going to be available for the instructor to refresh themselves on your simulation topic. The 9th item in your simulation scenario author packet is the completion checklist, and this is just that, a checklist of all the items that you need to complete prior to submitting your simulation scenario. Now, if you feel that there are additional items that need to be put on this checklist, please feel free to provide any questions, comments, or suggestions for improvement in the feedback form that we're going to talk about very shortly. The 10th item in your simulation scenario author packet is a case summary and stimuli. If you happen to be working on a case where you are provided with the patient case summary as well as patient stimuli that you're going to be using, you're going to have those materials in this folder. However, if you're working on a case where you're either creating your simulation scenario from scratch or you're using your own patient information from your own institution, you're not going to have any of that available information because you're going to have your own patient information from your institution. The 11th item in your simulation scenario author packet is the Supplementary Learning Materials folder. Now, in this Supplementary Learning Materials folder are going to go all the supplementary learning materials. One of those items that are going to go into this Supplementary Learning Materials folder is your STR, your Simulation Topics Review file. And what else goes into this Supplementary Learning Materials folder? All the other resources you feel will be of benefit to either the instructor or the learners to add value to your simulation scenario. So for instance, you may have found an awesome podcast that you may want to include in this folder. You may have created a worksheet or a handout for your learners to include in this folder. Be creative when thinking about things you want to put in your supplementary learning materials folder. And last but not least, the 12th item in your simulation scenario author packet is the feedback form. If you have any questions, comments, or suggestions, please fill out this feedback form and submit this with your simulation scenario. Once again, we'd like to thank you for your contribution to this national and international simulation book project, where we believe this will be the highest quality resource available for both simulation instructors and our colleagues and learners in medical education. Once again, this is Eric McCoy, aka McCoy, aka EMAC, from the University of California, Irvine Department of Emergency Medicine. Signing out, work smart, not hard.